Hello, my name is Nathan Raby. I am a liaison officer for Public Health COVID on Northwest Team 10 here at the Cameron Peak Fire. So some of the stuff that we're looking at when we come out to these incidents, the challenges, is of course COVID now. And always been our main goal is protecting the community. We work to protect the community from fire. We also need to make sure we're protecting the community and our firefighters from COVID. So part of the things we've instituted a lot of procedures and programs and things to help make sure that we protect everybody in the community. We also want to be concerned about taking it home to our families and our communities, so we want to make sure that we have our procedures and everybody following them. Early on in when the COVID started, a group of upper level fire managers and people that worked on incident management teams came up with the best management practices and wrote those down, and we've been following those. And as we've gone through the season, we've kind of adapted and changed things, that we've learned different ways of managing our actions to make sure we protect everybody from COVID. When we're working out there in the operations, a lot of times we are on our hoods of our trucks, looking around a map, discussing the fires and stuff like that. And with the distancing and stuff we do, and also masking up, it's made it a little bit more difficult. The big changes have been is in the fire camps and how we operate that way. We have to distance ourselves on our sleeping arrangements, our eating arrangements. We are used to the old buffet style food lines and stuff, and everything has to be packaged and taken out. And also making sure that in our meetings and stuff that we limit the number of people in our meetings so we can maintain that physical distance between individuals. Within the guidelines of the best management practices, one of the things that the firefighters have to do, they have to do daily screening checks and COVID temperature checks. And we utilize tools that report that back to us to identify any issues that we can track down before they become problems. Within the ICP itself, everybody gets screened. We use armbands to indicate that daily. And then we also make sure that we maintain our physical distance, that we're all masking up, and we're using sanitizers and washing our hands very regularly to help protect ourselves and protect the community. With wildland incidents, we always have to remember our primary mission is the fire, and taking care of that, meeting the objectives of protecting the community and protecting the natural resources. What COVID has done is just added another layer of complexity to what we do. And we just place in mitigations for that. We work through the issues and make sure that we can deliver those objectives and meet those objectives that have been laid out by the community and the agency administrators. This year has really provided a lot of good lessons that I believe that we can apply forward to next year, or some of the lessons that we learned will be useful for us for if there's a different type of contagious disease that comes out and how we handle it. We're really laying the groundwork and the base framework for our response to emergency incidents with a contagious disease.